Surgeons, doctors of Reddit. What's the dumbest thing patients have lied about? Do you smoke cigarettes? No. I quit. When did you quit? This morning. Part of my job is dealing with medical records. My favorite part is when you are reading the doctor's notes and you can tell they are fed up with the patient's bullshit from their tone. Patient in for routine colonoscopy. Asked if solids consumed in 24 hours prior. Patient confirms no. In process of procedure. Several dozen kernels of corn are discovered in colon and cannot continue. Patient specifically instructed not to consume corn beforehand as this happened prior visit. A common one is about their smoking. Smoking is an enormous risk factor for fracture non-union. Meaning a fracture that doesn't heal. When I walk into a non-union patient's exam room and it smells like a cigar den. I know they smoke. But they'll tell me they don't right to my face. Before signing them up for revision surgery, I'll commonly order a urine test for nicotine metabolites. Often it'll turn out positive and suddenly surprised Pikachu face. Edit. Lots of folks below rightfully commenting on how indicating you're a smoker increases your insurance premiums. This is true. However, the cost of complications after a surgical procedure would dwarf a lifetime of increased premium costs. I would still recommend that smokers be straight with their surgeons so they don't rush into surgeries that end poorly. Honestly, the dumbest lies are the one people who lie about how much alcohol or other drugs they use. Alcohol and benzodiazepine withdrawal can kill you. And if you use opioids from the street, then you likely have a higher tolerance and may need more medications in the hospital, so be honest. I truly don't care how much you drink, use. I just don't want you to get worse for something we can plan for and prevent. I fell down onto my couch and a cucumber was sticking up between the cushions. It went right in. Edit. I can't believe my top comment on Reddit is about shitty excuses and rectal surgery. Edit 2. Thank you kind Redditors, but shitty patient excuses for rectal obstructions don't deserve Reddit awards. Too funny. Penis modification. The case was an elective above the waist surgery. And he denied piercings. However, when the nurse went to place the Foley, she found the patient had modified his penis and it was split, bifurcated with multiple piercings to look like a cobra. The nurse did not know how to insert the Foley. The piercings also limited the ability to use electrocautery. In addition, he also embedded a metal implant inside his testicle that looked infected with a possible abscess. Cancelled case. Called urology consult for infection, abscess evaluation. Guy came in for a wound on his lower leg that he said came from a biking accident. X-ray revealed a bullet inside his ankle joint. The wound was from shooting himself by accident while holding a gun. Still don't know how he didn't fracture anything. Patient says to me, I was outside gardening while naked and I slipped. That's how a massive potato ended up in my ass. Anybody want fries while he is waiting to get it removed? How did you get that stab wound in your abdomen? I put a knife on the kitchen counter and forgot it was there. Then I walked into it. Me. Have you had anything to eat or drink today prior to your surgery? Patient no. With a half-eaten candy bar in front of them. Me. Are you sure? Because if you have, you could vomit upon going to sleep and it could enter your lungs, causing you to die. Patient. Then yes, I have. I had half that candy bar. This one guy repeatedly used to come in saying he hadn't shit in 7 days. This would usually necessitate a rectal examination with a finger. That's why he kept saying it. Patient used to come in every time the new doctors rotated in. Who wouldn't be wise to his tricks? One guy came in feigning unconsciousness. Did not respond to even the most painful of stimuli. Some of these were pretty painful. Did not budge. We were talking amongst ourselves about intubating him. He then opened his eyes and said, they did that last time. I didn't like it. Not considering the psychiatric and the boring answers, like people who just swear with all their heart that they are taking their medications when they clearly aren't. Which is the vast majority. There's not much, really. Only one really unique comes to mind. It was a patient that was a really kind old man who always would talk a lot with us. Telling stories. Praising the beauty of everyone in a tender and respectable way. Saying how really grateful for our work he was and so on. Said old Mond would always appear with really high blood pressure values. Even though he would swear that he always used his medication correctly. And after we did so many changes with his medication in many different ways. It's only natural to think that there's some problem with how he's tackling them. If he was doing it at all. However, one day, after noticing that he would always go to the bathroom before even reaching out to the receptionist, someone discovered he would always eat a load of pure salt before being seen by any of the doctors, trying to make his pressure intentionally go sky high. Later we also, obviously, discovered that he indeed would not take his medications correctly as well. In order to obtain this result again and again. Turns out he suffered a lot from loneliness. And he was an old man that didn't had much contact with his family anymore. But mostly because his family didn't reach out to him almost at any given time. Even though everyone lived close by. And in his desperation, sustaining dangerous high blood pressure was the best way that he had to obtain human contact within the emergency every week. This was the most odd one. But it's really common in general among elderly patients to appear lying about their symptoms, only trying to gather some attention and a private minute to speak about anything else. Most of the time they book an appointment only to talk about recent trivialities, which makes them clearly better. Although by the end of the talk, it's also easy to see how they gather back part of the sadness that the loneliness bring to them. Around my patients, at least, it's common for many to cry as they leave. Loneliness is a hell of both a simple and complex problem, and one that no one should be bound to live with. Their age. Had a woman say she's 30 when she clearly didn't look it. Oh well, I move on to other questions. Look at her files and lab reports have her real age on them. 41. Like why though? What difference does it make lying to healthcare staff? This is health related, not Tinder profile. Nobody gon' see this and go I ain't dating an old lady. By the way, she was married with children. I had a lady tell me she had no idea how she got a rash she had on her face. I left the room, gave report to the MD, and when I walked back in with the doctor she looked at me and said, "I didn't think you'd be coming back in the room," and then proceeded to confess that she'd been cheating on her husband and thought she had herpes. She did not have herpes. It's not so much a patient lie as it is me being dumb, inexperienced and uncomfortable asking necessary questions. I had a hypothetical patient during residency that was a very manly veteran and I was admitting him for rectal bleeding. He was in the age where it more than likely colon cancer. So I didn't think it was necessary to ask a sexual history. Folks at this particular establishment were known to at times be homophobic and I had been yelled at by patients previously for asking, "Do you have sex with men, women or both?" It ate away at my conscience, though, so I went back in absurdly nervously and asked him. He answered, "Son, I'm as gay as a rainbow. I've been at the bathhouse for the last couple of nights but I wasn't sure how it would go over to admit it." That's when the bleeding started. It was a very important lesson for me. My dad neglected to mention he had no teeth since 1976. We found out in the ICU in 2022. Do you have any medical problems? No. So no diabetes? No diabetes. What medications are you taking? Metformin. For my diabetes. I facepalm every time. One of my favorite things I wrote my first year out of medical school. Please note patient has stated multiple times that he wants to leave and would leave AMA, against medical advice. He asked multiple times whether he could eat and stating he is hungry. Explained to patient that we would like to start a full liquid diet first and if he tolerated it well, would transition to regular foods. However, Pint ordered Chinese food delivery instead. Then, patient was complaining of a headache. Was given Tylenol for the headache. Patient stated that this did not help him. His sister at bedside went to the nearby pharmacy and bought goody powder, aspirin. Sister did ask whether she could give him goody powder. She was told not to give patient the goody powder. She supposedly did not. For context, the patient had a catastrophic GI bleed from taking too much aspirin. Since you included surgeons, I'm expecting someone to pop in and talk about all the patients who lie about the no eating 12 hours rule, or are unclear on the details. Nurse here. The absolute dumbest thing patients have said. And to be fair, this was the patient's parents since I was in petty but still dumb AF and caused no end of grief trying to unspin it. I was rooming patients and I went to the full lobby and called the next one in by last name. They stand up and mom and dad bring the little girl back. I'm rooming them. Take the vitals. Review purpose of visit. Make some adjustments to the chart. Update their pharmacy and allergies and go out and let the pediatrician know they are ready. The pediatrician goes into the room and come out like 3 minutes later and says, "That's not my patient. Where is my patient?" I'm like, WTF? I go in and ask the parents and no, in fact they were not the patient. I'm like, why did you say you were someone you were not? They simply said they didn't want to wait, so they just came back. We had to completely unspin all the changes to the chart and had to get legal involved to make sure there were no HIPAA violations. Which fortunately, there weren't. I'm fascinated that people can collectively think, yeah, let's do this. No one will know. Like, how does that even play out in their minds? One dude lied about being paralyzed after a lumbar puncture. Get a call from nurse, patient says he can't move legs following a lumbar puncture, spinal tap. I called the team that did the procedure and they assured me there was no indication of this sort of injury happening during the procedure, but agreed with my plan to get an urgent MRI. I go to examine him and nurse says she thinks he moved one of his feet. Next thing I know, he says he can actually move his legs again, but they are feeling weird. Then this weird feeling turns into intense pain and he asks for intravenous narcotics, Dilaudid. I tell him no because this story makes no sense. By God, it was a miracle, I tell you, when this man walked himself right out of the hospital after I refused the IV narcotics. Also, the MRI was normal. Patient: I haven't drank alcohol in months. Patient's family: it's true, I've been with her the whole time. Me: ma'am, your alcohol level is 325. Patient: impossible. I would never lie to you. First baby: never pregnant before. New OB appointment. We collect everything and do exam. I put a speculum in and I see her cervix. After her partner left the room, I ask her again, and she says she doesn't want her new partner know that she's a single mom. Not dumb, but just very obvious on an exam that she has definitely given birth before. I left a note on her chart to not mention prior pregnancy in front of her new partner. Another on my gen surgery rotation as a medical student. Removing objects from rectums due to unfortunate falls. Resident doctor here. This happened during my psychiatry rotation in medical school. I wouldn't say it was a dumb lie since the patient was mentally ill, but I would say it was the most memorable lie. There was a patient at an inpatient psychiatric facility for suicidal ideation. She constantly insisted that she had a mass on her breasts and demanded to be physically examined only by male doctors. When the psychiatrist I was rotating under declined to perform a physical exam, she asked me to do it during my daily patient interview. I also declined physical exam, but had a bit of a hunch to check her medical records. It turned out she had an ultrasound done a week before that found only normal breast tissue without masses. However, apparently this lady had frequented many doctors' offices with various complaints of an unspecific nature and would usually focus on breasts or vaginal complaints when she visited male physicians' offices. We diagnosed her with factitious disorder, formerly known as Munchausen syndrome, and histrionic personality disorder. It seems her goal was mostly attention from medical professionals. She had lots of issues. But we also had to be careful to make sure she wasn't fishing for a lawsuit. Patients like her are why doctors document everything meticulously, so the patient wouldn't admit to making things up all the time. According to the psychiatrist I was working with, she didn't actually believe any of her health problems exist, and her primary goal was the attention from medical professionals. If she actually believed she was sick, we would have diagnosed her with illness anxiety disorder, commonly known as hypochondria. I had a guy insist that someone else put cocaine and heroin in his urine, even after I tried to move on with the conversation. I had a patient that lied about having a job. I asked because he had hepatitis A and I wanted to know if he needed a medical leave. He denied it even though I asked twice. Next day, he came back because he was going to get fired if he didn't provide a doctor's note. My girlfriend was in a mood with me and I thought I'd cheer her up by juggling knives, and then I accidentally stabbed myself in the thigh. Said by 19-year-old patient. Not a single person in Ande believed this nonsense. The worst I've heard was from the ed. Common question before shooting a X-ray is how did it happen, because I may have to use an optional position or something. From women. I tripped on the rug. I dropped a heavy box on my hand, foot. It was dark and I didn't see that the door was open. There's always a social worker in the ed and we'd take her to imaging, for better shots. Sometimes radiologists would order a SNAT series. Suspected non-accidental trauma. Where there's one break there's always a history of more. Dad is a physician and has a million funny stories. He told me this one from a few decades ago. Had a patient come into the ER with a towel over his groin. Covered in blood. Claimed he was cutting vegetables in his kitchen and the knife slipped. Dad takes a look and the guy is butchered down there. Had to call a urologist in the middle of the night to consult. Guy eventually confesses to trying to give himself a circumcision because he didn't want to pay the $200 it would have cost. Urologist was able to help save him. But it cost a hell of a lot more than $200 for emergency penis surgery. I work in ophthalmology. I see patients nearly every week that are faking vision loss. Most often, it's to try to get disability. Sometimes it's just attention-seeking or extreme stress, anxiety. In rare cases, patients truly believe they cannot see or have convinced themselves they cannot see. When all exam findings and testing are normal. It's called non-organic vision loss. I'm just a med student, but a doctor shared this with us. She's a gynecologist and this woman came to her complaining about how she hasn't gotten her periods in few months and well she was showing menopausal symptoms and in fact she looked almost 50 but she kept saying she's only 30 and she can't have menopause. It has a funny ending. When the doctor asked if the woman had a kid and she said yes he's 27 why, oh. Tears of joy, tears of joy, tears of joy. IDK why people lie about their age, but this was a funny story for the whole class. Did cocaine the night before elective surgery. Didn't disclose at pre-op. Cardiac arrest. Beta blockers and cocaine don't mix well. Anything. To be honest. I honestly don't care what you do or don't do. Usually if I'm asking it's because it matters for your healthcare and if you lie about it all you're doing is putting yourself in danger. As a more real example, I've had a post-transition transgender patient lie about the sex they were born with. I understand it's hard to deal with a lot of the medical community that can be judgmental. But this patient ended up having prostate cancer. Only found out after we scanned them. Another one lied about having prior back surgery before I was about to send them for an MRI. Did a physical exam and saw the scar. Asked again and they just said they didn't feel it was important and didn't want me to assume it was related to previous surgery. They were there for back and abdominal pain. Not yet a doctor, but soon to be. It's not uncommon for patients to lie about drug use, abuse. I am a former addict. Please don't do this. It's one of the most important things for us to know. And you won't, at least shouldn't, be reported, frowned upon or whatever. And #X200B. Edit. People. The world is not solely the United States. I feel really sorry for the atrocity of a health system you guys got there. And no human being should ever be red flagged for such thing. WTF Murica. For context. I've gone to once due to key cramps. And after some talking and research by the doctor, he agreed on giving me morphine to cease the pain. Woman comes to EMERG with complaints of vaginal discharge and discomfort. Pelvic exam initially reveals significant yeast infection. But there appears to be a foreign body in her vagina. Is there something stuck inside? No. I don't know what's in there. Speculum examination reveals a very soft mandarin orange. Peel still on. Oh. That. We heard it would improve our fertility. You can't make this shit up. I recently had a patient double down to the point of yelling that I never told her to stop her aspirin for a lung biopsy. During our clinic visit she told me she didn't think she took it anymore. But I reiterated it multiple times, including asking her to check if she took a brand name and wrote it in my clinic note in 2 separate places that we discussed it. Sure enough, she arrives and says yes she takes it and no one told her to hold it for 5 days. Yes ma'am we did. Well it's Monday. Our clinic appointment was Friday. How would that make any sense that you told me? Ma'am the appointment was last Wednesday. Oh, I just don't remember. Just open with that and we'll reschedule you. It's fine. I read this study from the 70s I think where they examined the uprising amount of penis cutting incidents. Turns out lot of guys are fucking their vacuum cleaner and at that time the German company Vorwerk had a vacuum with the motor right next to the pipe and the motor cut up the dicks. The interviews were just ridiculous as what the guys claimed the cutting wounds were coming from. My little brother was a nurse for about a decade. He has said many times that people stick anything up their butts. From light bulbs to hairbrushes to a golf shoe. And at first it's hilarious. Then after a year or so it's not funny because you've seen way too many distended buttholes. Then after a decade or so it starts to get funny again because you think you've seen everything, and then one day a 45-year-old man is driven to the hospital by his wife and he has a golf shoe up his ass, and he told his wife that he and the boys were golfing and he slipped in the locker room and it got rammed up there, completely disregarding the fact that the part of the shoe that is inside him is covered in Vaseline. Not a surgeon or doctor, but an anesthesia nurse, OR nurse. But a mom directly lied to us about her 12-year-old pre-ent surgery. We always confirm with the patient and legal guardians all the pre-surgery checkup. Name, age, date of birth, any past medical history, common medication, and medication took in the last 24 hours. Surgery proposed. Last time you eat or drink anything. The thing is, in the last item of the checklist the mom lied. Her answer: no, he doesn't eat anything since yesterday. The kid confirmed. Note that it was 4 p.m. Outcome: surgery went well. No problems. When comes the time to remove the tube, the kid starts vomiting tons of rice and beans. When I say tons I mean at least 1 kilogram of said food. The kid aspirates part of the food against our best efforts. We aspirate, do everything we can including a bronchofibroscopy. Everything ends up okay. The kid survived. No further complications and recovered to full health in only 2 days. When confronted about the lie, and explained how her son could have died, the Karen mom said, what could I do? He was hungry and eats like a bull. Who am I to say he can't? We all lost our patience and just said his mom. He could and was close to dying because of this. Conclusion: please take the fasting period and pre-surgery recommendations seriously. Any doubt, be honest with your health team. I fell on it in the shower. Medical school student. Not a big deal, but a patient lied to me about what she had eaten. She was obviously having some problem with her gallbladder. Typically this pain can be caused by greasy food. So I asked the patient what she had eaten before she got this pain. Patient said she only ate a salad with very little ranch. That's it. I even explained how greasy food can cause this pain, but she's adamant she only ate a salad. Anyways, I report back to my attending and we see her together. The attending asked her what she ate. The patient said salad, then adds she also ate a burger. It wouldn't have changed the plan, but why lie? Anesthetize people at work. It's important to know what drug someone's body is used to so we can tailor an anesthetic. Rarely IV drug users deny taking drugs even when they're having surgery for an abscess due to a skin infection from injecting. It's on them. They're at higher risk of being aware under surgery if they're meth addicts or not having any pain relief if opioid addicts. It becomes readily apparent once truckloads of opioids don't work. Funnily enough, no one in 5 years has ever admitted to being addicted to cocaine. Most opioid, meth addicts are fairly open with their drug use. My favorite was a guy that denied any ketamine use. Was pretty apparent after 600 milligrams or 3 to 6 times a standard induction dose as he was merrily chatting away to us. Relocated his tibial and fibula fracture while he was telling a story. Lol. Adherence to medical treatment when I have literally pulled their pharmacy records and know they haven't picked up their medications in over a year. Retired paramedic here. The dumbest thing I saw patients lie about and think we'd fall for? That's tough. It'd be either the unconscious fakers or the drug seekers. The way to quickly check if a patient is conscious or not is I touched my gloved finger to their eye. If you blink, I got ya. That's when I'd get down in the floor and say, I know you're faking. Here's what we're gonna do. I'm gonna help you up and you're going to get up. Act your age and stop freaking your family out. The seekers were always, I'm allergic to most painkillers. But I'm not allergic to the, how ya say it, lauded stuff? Straight to triage you go. Weirdest sex lie. I was chasing the dog while vacuuming naked and bumped into the pencil, causing it to go into my bladder. Most common lie, about the volume and types of drugs and alcohol they use. So sick of the shocked Pikachu face when I ask about how much they use instead of if they use. I genuinely don't care what they do in their own time. But the information is really important. In the 4 a.m. Teenage girl and her parents arrive. She's been constipated for days and no poop has come out at all. I was busy, so I asked the nurse to check if the patient indeed has poop and needs an enema. So a rectal exam is needed. A few minutes later the nurse urgently called me. When we uncovered the girl, she had tons of clothes. We just saw this cute little head popping out. A baby on the way. Why didn't you tell us that you were pregnant? I asked. I'm not pregnant, she kept saying while I was cutting the umbilical cord. She lied to her parents, don't know how to this day, the whole pregnancy. She lived with them. I had to explain everything to the parents. They didn't have a clue, and judging by their face, I believed them. My wife is an OB/GYN. Ma'am, do you currently have something in your vagina? No. I don't think so. Pulls out vibrator. Well, I just found this. Oh my god. I've been looking for that. How that thing got stuck in their booty hole. 10 out of 10 they have zero recollection of how it got there and swear up and down they fell on it. LMAO. If that's really the case, we need something to protect our butts. I spilled all my Adderall down the sink. Again, twice in 1 week. Of finals week at uni. X-ray tech here. Did you follow the doctor's instructions on the prep? Yup. This for a barium enema. Had one guy where we barely got the bag to flow in a scout. He was literally full of shit. Ascending, transverse, descending, sigmoid all full. We got about 20 milliliters in. Now here's the problem. After a B you're supposed to drink 2 to 3 quarts of water as quickly as possible to flush your system because the barium left in you. You don't expel it all when you go to the toilet right after, will harden and cause real problems. So we had to get a PA that happened to be walking by to examine the PT and order an enema. Which was done elsewhere. Never saw the guy again. We quit doing BEs except in rare situations. Not me. But my mom used to literally tell my doctors I'm lying about my headache. They'd believe her because I was a child and I never really showed my pain. No screaming, crying. Just quietly explaining that it hurts. When I was 16 we had to get me to an because what started as another headache slowly turned into me passing out randomly and losing the memory of entire weeks over the course of a few months. I wasn't, in fact, lying. I was, and still am. But now I'm treated. Suffering from a chronic illness that could have killed me if it went undiagnosed and untreated. Had a patient show up the with a wound to the back of her head. I say, hey Ms. X. What happened? I don't know. I picked up chicken from the gas station and went to bed. And this morning I noticed I was bleeding. I start inspecting the wound. Looks like it tracks pretty far. And there's this strange cotton-like material sticking out that is also tracking too deep to visualize. I press her some more about the circumstances because my doc spider sense starts going off. Me. Were you assaulted? Did someone harm you? Were you in a car accident? Did something fall on you? Patient. No. I just went to bed. Maybe I got up in the middle of the night to use the bathroom. Finally I decide to send her through the donut of truth. AKA get a CT scan of her head before me and my trusty scalpel start seeing where this trail of mystery cotton leads. The lady had a bullet lodged up against her skull bone. Still don't have an answer to the cotton. But I'm guessing the gun fired through some cloth. When I told her she had a bullet in her head, her response was, oh. Weird, and then she went back to playing Candy Crush on her phone. Not a doctor. But remember a guy asking how he would get a small cylinder, 1 inch in length, 5 in girth, unstuck from a mini Mandem's tube filled with butter and microwave smashed banana. Teenage patients lying about being virgins. Especially after a positive pregnancy test. Or being diagnosed with an STI. Thank you for watching. If you enjoyed this video, don't forget to drop a like. If you would like to see more content like this in the future, subscribe and turn on notifications to be notified about future videos. Now check out one of these interesting videos.